learn a lot of things from that. So, and I, around 10 years ago, like I say, come here. I didn't want to go be a dermatologist again, because to be in a residency 4 years, learning what you already know, it's a waste of 4 years of your life. So one smart doctor tell me, just go to family practice. You will learn a lot of different things, what you never did, but it's cool. And it was really fun. I did deliveries, small guys, children, surgery. It was great.
Yeah.
And like you maybe know from my friend, I practiced family practice in Mural Inlet from 2009 till 3 years ago. I actually in 2018, I was the best family physician in Myrtle Beach, officially. So I even have a letter from House representative. It's not because I would like to show who I am, so I'm so good, but I mean, so you can free to ask everything. My experience give me opportunity to learn a lot. And around 10 years ago, actually, when I'm talking about military, when I got to Army and I was 49 years old, and I really didn't think to be a doctor there, but they said, no, girl, you're going to be an officer. Like, really? So they sent me to marathon, gas chamber, and officer training, and everything else. And in my 49 years, I was 50 when I got the officer training in a camp for 3 weeks in the field. With raffle and gas chamber and running and the boots bleeding from my heels. I said like, that's so interesting. I thought I'm in good health. I was 25 pounds heavy and I thought I'm perfect. I was completely satisfied how I look, how I feel, and I thought I'm healthy. All my blood work was okay. They took me to Army. And I didn't realize I'm going to aging. Till 50 years old, I thought I'm young, I'm strong, Army strong, I'm fine, and I even didn't think about anti-aging. I knew a little bit geriatrics. I don't like this terminology, but it's what it is, because of family physician, but I never kind of thought about it. And I never thought how early we're actually going to think, we need to think about what's going to be the next, about quality of life. So it gave me a lot of thoughts, and I enrolled in it's called anti-aging medicine. I don't know if you hear or not. I have somewhere a certificate about one of all of them. So it's called anti-aging medicine. By the way, you can Google it and read a lot of good things because it's a medical profession. It's international. In December, I was in my annual meeting. So it's a whole world doctors got together and talk about how to mature nicely, smoothly, and not so fast. So I enrolled to them and I was really love it, and I still very connected every year. I go to conference since gotten in Las Vegas, why not go, and see all new things about anti-aging. And it's very lovely. And I was with them, so I was with them from 2011. So pretty long experience, and I learned a lot of good things. I started for myself because I was a regular family physician. I really did not have a time in my visit. I tried to dedicate the time to my patient, but really didn't have much time to talk about aging, maturity, quality of life. And when you see 28 patients a day, it's not much time. Yeah. But I did it, and I continue to do it for myself, for my friends, for my relatives, because I truly believe it's not about life. It's about quality of life. Because to have a life sitting in a wheelchair and looking in a window, excuse me, I cannot call it life. And I actually agreed to be a medical director for hospice, and I actually was today. In my meeting from 2011, I'm medical director for different hospices, and now I'm medical director for Medicis. So if anybody from your friends been there, they maybe hear my name from this perspective. I still full-time medical director for them, 24 hours, 24/7 on call. So I'm looking how people got old. So unfortunately, I see how they finish to be old. And it is kind of sad. And you see, not in for me, in my clinic about that. Okay, everybody, almost every doctor, can do sore throat. Better or worse, pneumonia, even COVID. But medicine problem, we're not talking about quality of life. And best example why I finally opened this clinic, because when it was when COVID came, and it showed all problems with our medical system, not only American, general, about our view, not only how the doctor looking on our health, but how we looking on our health. Because I like British words. They say, we all in the same storm. It was a COVID, but we're in a different boats. And somebody is a canoe, and somebody big ship, which you'll never get from. And it's what show up, because everybody got sick with same virus. So enemy, if we talk in military language, enemy was same. It was same guy who attacked us. But some people even did not notice it. I know a lot of people who've been sick and they even did not have any symptoms. And another people just died. And another people just still sick for last 3 years, long COVID symptoms.
Yeah.
So it's not a fault of the COVID. If just this COVID was one of, I like to look on the life positive. So this COVID, we know, all of you know how bad it is. But I can tell you one good thing. COVID showed us, and medical professionals as well, you cannot imagine thousand and thousand doctors start to change their specialty. And now they're doing wellness, holistic, and all lifestyle, anti-aging. A very big number of doctors understood that. And everybody who can do that, they did. And patients as well. People start looking, what's wrong? Why my neighbor just walking around with a COVID and I'm lie down in a bed like dead body? It was same COVID, because it's same like in the military. It's not who attacked us, it's how we have defense. Our life, our quality of life, I'm sorry if I tell you some obvious things, but I just would like to tell you how I'm looking at life and health and wellness. So our health, our maturity and everything else is not depend, but environment, everything else, but it's same for everybody of us. But we got mature, elderly, and quality is so different. So we just really have to look more. And first and second one, nobody care about our health. We need to guard these thoughts. It's no medicine, it's no, Medicare, Medicaid, whatever is president it is. I really honestly don't care. I know America's the best anyway. Nobody can distract it. I can compare with another countries. So, but whole point is we need to care about ourselves. And we have to dedicate our time, our money, our thoughts to our body. Because we do have one body. It's one. They give it to us, it's it. Maybe some point they can start to replace the thoughts. Sure, not you, not me, we will not live for long. Nobody give us, no, transplanted, I don't talk about it, but nobody can give us any new part. And I all the time do this way. Okay, we buy a car, and some cars, body is very simple, very simple. Doctors try to make it so fancy schmancy to be sure you appreciate the doctors. But it's not true. Whole point is, we like a car. We got a car, okay? And some people driving car for 25 years and still look like new and just got antique and actually more pricey. Or some people you're looking in the car, it's a garbage in the back and nobody care. 3-4 years and it's piece of junk. We same. When I talk to people, I say, okay, when you been last time to check oil in your car? They say date, and they say how much it cost, and they say what brand of oil they say. Really, seriously. And they say when's the next appointment for annual car, whatever, maintenance. And I say, okay, what medicine you take? I don't know. I said, what? You know, oil of your car, and you have no medicine. And if you ask, when you been out last time, like two days ago, how much you pay for the bill? Whatever, $25. How many milligrams your metoprolol? I don't know. So we have to count. I hope you do already, but sorry if I don't mean you don't do that. But first of all, we have to start to care about ourselves. And don't count anybody. Not PCP, cardiologist, We use them, but we have to use them. We not count somebody will help us. Not our friends, not our relatives, not our children, or our doctors, or system, or whatever, Medicare. Nobody does. Until you will start. So if we would like to mature and have a quality of life, first we have to start. We need to know ourselves. And I can tell you, say, don't take it personal, I don't know you much. I know this girl, she knows everything. And she's really health-oriented. For so many years I know her. And by the way, her son is same. I know one son and he is God same. He cares about himself very well. So, but unfortunately I see different example. So first of all, you have to have very clear picture of yourself, where you are now. If we're talking about how we going to be older, I don't like old, I like mature, because we're so mature, and that mature, and I call it maturity. So we need to know what is our story. First of all, before you start to thinking about future, it's like any country, any family. Till build your future, we need to know your past, and we have to appreciate our past. You have to take a seat, any one of us. I do have my essay. Have to take a seat and write or type whatever you like. Everything about your life from perspective of health and wellness. You need to know and put this in paper from childhood, whatever you remember, what you've been sick with, what did you take, whatever usually doctors ask. But all the time, I have a history and physical from different point for one patient, and it's all the time different. You need to have very clear picture where you start from, what you went through. My appointment usually have an hour, and the patient still, oh, I forget to say you, I had a Lyme disease in 25 years old. Really? Now we know why your arthritis is here. Or same and so with like, recently I had one patient, she's healthy, 62 years old, my age, and we talked to her, I said, why you have bronchitis 3 times in a year? Oh yes, I just whatever, excuses. I said, no, something wrong. We start to talk and finally say, oh yes, I know now. She called me back. I talked to my mom, I talked to my family. My dad died from lung fibrosis. I was like, seriously? And you follow me 2 years, and I digging and finally, anyway, she has appointment next with pulmonologist, so we have to prevent developmental fibrosis because I already see she has a symptom of it. For this reason, doctors see you 10 minutes usually, okay? And this problem is nurse asking your history, and doctor come talk to you. There's something lost in translation between. But you need to have very clear picture. All. When medicine you start, when you finish, what dose you've been on. Because, for example, if patient had alapurinol in the past. I have to check his vision now, and if his vision changed, maybe because he's taking some kind of medicine. And if I don't know, I will completely different treatment for this patient. So it is big homework. If, like I say, you ask him like my advice, what start point. And you need to make it kind of little bit readable, because and it's supposed to be a file. I usually give a patient my file to start from, and who follow me actually have a bigger file. They bring me all papers they have, and I organize it for them by topic. But everybody can do themselves. Because we can, like I said, we're talking about to be longer, living alive. And at some point, lady fall on the floor. They brought her to the hospital. And her neighbors have no idea who is she from standpoint, they know she's nice old lady, but they have no idea what happened in her life. This file is supposed to be in a visible place, and everybody whom you know, you need to tell them. If you take me anywhere and I'm weak or stupid or hurt myself, cannot talk to myself, you're taking it with me. Some my patients actually make it copy. So just take this copy with me. Or if you go to any doctor, you're taking this copy. Doctors know how to read. Not everybody knows how to listen patient. Just listen whatever they say, or don't have a time for that. Everybody read. And we usually read very fast. So if you got to emergency room, they have your paper. They go through that. It takes for them 3 minutes, and you will have a right diagnosis. If you go to new patient, new doctor, cardiologist, pulmonologist, neurologist, whatever, they will not dig in you. They have no time. Maybe desire, I don't know. And you maybe don't remember everything. You bring them this paper. And like for lady with arthritis or lady with bronchitis, for me, it's not because I'm so smart, it's just because I trying to gather history. So, I'm sorry to tell in details, but it's the first you need to do to be sure you will age in proper. Because when you see what problem you had in the past, you can see what you have to pay attention to. So if you will recall you had a car accident 15 years ago, you need to be sure you have your x-ray of your neck, you want to be sure you're doing regular massages, because most likely you had a trauma of your neck or whatever part of the body. So you have to do additional attention according to your past medical history. And wellness as well. Like some people been in sport, when they've been in gymnastics, and say, oh my God, I have a headache, and they take pills for migraine. It's all a real story. When you're tired, tell me, I can stop, because I can talk endlessly. And a patient came like migraine, she's on migraine medication, even new injection for migraine medication. We start to talk and talk and talk. I'm fortunate, it's not because I'm so good, it's just because I'm fortunate. I see 5-6 patients a day. I have a lot of time to talk, because my big job is a medicine. Here I play games, enjoy my job, that's it. And I can do whatever I want. It's my privilege, I mean it. So not every doctor has it. But anyway, and we start to talk and talk to her, and we saw she been cheerleader, if I pronounce right way, and she had a few falls from top. I said, girl, what are we talking about? We checked her neck, she had a big sclerosis, it's pushing on her nerves, she has a headache. No, okay, when you know diagnosis, every doctor knows how to fix. So we got her under control, but at least she stopped this dangerous migraine medication, which actually didn't help her much. So I'm hopeful I'm telling you. And a lot of an example, what we have to start from. We need to have our basic. Past. Then next question, we have to know our basic, who we are now. You have to you need to have a list of your problems. I'm sure everybody of us have. Even I'm nice and healthy, but I can start hypothyroidosis, diabetes, and blah, blah, blah. So, doesn't matter if it's control or not control, you have to make a clear list of current problems. Even it's not a problem, it's just a diagnosis. No, definitely if you put hypertension, you put in what you're taking for. When you know when you put all together from all doctors, when we making this list for the patient, you can be amazed. They come say, I have hypertension, diabetes. We keep talking, and in a couple of weeks they have a list like that. What else they have? Because I don't have too many young people. Anyway, so it's a second what you do for yourself. And don't count doctors will do this list. They don't need to. Because to bill your insurance, we need 3 diagnoses. We actually cannot put more than 3 because we got paid just for 3 of them. So every doctor whom you go, they make a choice for 3 of them, and they don't much need rest of your list, but you do. Okay, it is the second, and then definitely when you're looking at that, you can talk to somebody or yourself. You look all of them really smart. At least if you, I say why? Because you're thinking about how to stay good quality of life. It's mean you're still okay. So then I usually say patients, this one you can do whatever convenient for you. Some people like to do table on a computer. They do like kind of say spreadsheet. Yes. I like, and most of patients, you're doing big lists. Then you're making like, this card, like school people do, and you put, for every card, you put any problem, first of all, diagnosis. We're not talking about complaints yet. We're talking about official diagnosis, what you've been diagnosed with. And you put it in a separate sheet. And then maybe every day you're taking one, not obsessed, not be worried about. Just be open and don't stay in denial. And looking at that, okay, I have a hypertension. Like example, everybody knows my blood pressure up and down, then what do I need about that? Not what somebody will do for you, what you can do about it. Okay, taking medicine regular, I'm good to one. But you need to know about every medicine. For example, if you're taking metoprolol, you not count your pharmacy tell you. But if you're taking beta blockers, you need to know you take it at night. If you're taking lisinopril, for example, you take it in the morning. So you need to know about every medication you're taking it. You can read because pharmacists give you paper. They used to explain it to us. Unfortunately, now not much. I know a few pharmacists. I work with Publix, Lee, Costco, sometimes Kroger. Because they still talk to people, pharmacists I mean. They still telling people at least a little bit. So I do education, for example, about levothyroxine, and I did my lecture online. So what time to take, what you cannot take. For example, some medication, levothyroxine. You take in levothyroxine and same point you will take a milk right away. Your dose is dropped in half. So it's like example, a lot of medicine you cannot take together, you better spread it, what time of the day to take this medication. Even you take it like 20 years, it doesn't mean you're taking it right away. So, and sometimes people keep increase the dose or give additional medication, but you just taking it in the wrong time. I have a patient, she's taking trazodone in the morning, and I look at her. Why are you taking trazodone in the morning? I take trazodone as medication actually for sleep. No, when people sleep because of anxiety kind of state. It's kind of for depression, anxiety, it's called a mood disorder.
Right.
But generally it's help people to sleep. So it shut off our computer and we go to sleep. We start thinking depressed and we sleep. I said, why are you taking it in the morning? She said, I don't know, I've taken it 20 years. But they tell you when to take, what you take it for. Oh, I take it for anxiety. And she came for me because she couldn't sleep. I said, you have a medicine for sleep. Oh yeah, I take it in the morning for my depression. Are you depressed? No, because I take this medicine. You're generally not depressed. And this medication for sleep. Why I have to give you, she came, I would like to have Ambien. Why I have to give you Ambien If you already have a medication you take in 20 years, and you taking it in the morning for what reason? Because of depression. No, so was sometimes happens this way. We just taking medication. One day we took it wrong time, and we continue taking it wrong time without anything. I hope enough example for medication. So, what time you can read? You can read online. I'm fine. Some doctors don't like when people looking much. Dr. Google is good doctor. But anytime you'd like to change, you write it down, send a message to the doctor, say, yeah, I read so and so. How do you think? A doctor or nurse practitioner, whatever whom you have. You're okay to find it because you know your symptoms, a problem, much better than any doctor. So you're okay to Google it. My patients Google it, but they usually, I said, don't start to do something until they're asking me. But it's okay because they can find, when they read it, very frequent happens, they read, oh my God, I have these symptoms. I said, you never telling me. I didn't think it's symptom, I thought it's okay. It's not okay. So at this point, medication is supposed to be clearly know why you're taking it. How does it work for you? What time is better to take? Can you take these two medications together? For example, have alendronate for osteoporosis and calcium at the same time, even though for same reason, is wrong. And as every medication has some optimum. Doesn't mean it's bad, but you need to find the best time and dose and how to take, how to control, how to spread it through the day, because if you start to take proper way, maybe you can decrease the dose. Maybe you need a less medication. Because my goal for every my patient, I do medication, even I do integrative medicine, I don't discharge medication until we got symptoms under control. I do prescription, everything else. So, but goal for everyone, if we're going to be older and live 20, 30, 50 more years, your generation going to be, if you're doing everything okay, and if you don't have too much blames the parents for, if they didn't give you some kind of ugly disease, and roughly 105, 110 years old. And I'm not joking, you plan your money, plan your quality. I have in my hospice, like I said, I came just today from there, I have 6 patients who over 100. And they've been totally independent at least a few months ago. Now they're in hospice, but they're over 100 and they've been completely fine, living by themselves. So, and it's now, so as longer we live, we will live longer. So this is biggest concern. And if we're not looking very cautious what medication we take, we will have more and more and more medication. And if we got one medication every 5 years, what's average in America? It's not I say it, statistically. So if you live in 20 more years, you will have a 5 more medication, roughly, on top of what you already have, or maybe more. So be very, you control your medication, not the doctors. Another story about medication, you have to have a picture of the bottle on your phone. Everybody has a phone. It's not about cat and flowers and nephews. I even tell my patient who has a kind of strong medication or medication which dangerous like blood thinners or something like that, it's supposed to be in the top of your phone. Because if somebody finds you in the street, they see not your uncle or whatever, grandson, or I have my two grandsons on the top, but they see your bottles of your dangerous medication. It's very important for quality of life and how we're working on it. Because if you got something happen, car accident, not mean be old, just car accident, and if you not care about how to let everybody around what are you taking, your quality of life going down because they don't know. I know one example only I tell you. I actually have everywhere so people need to wear bracelet. Like soldiers wear, like I have had mine. Where it's supposed to be, if not whole list, but at least of medication what you dangerous one. What condition you have. If you have a diabetes, even it's perfectly controlled, it's supposed to be somewhere people see. I usually teach my patient, you make us type it or write it, or you can just cut name of medication from prescription and put it in the back of your driver license. If you don't wear like bracelet or anything, list of medication you take, supposed to be glue typed, whatever, and the back of your driver license, because whatever happened, they all the time looking in the wallet for driver license. It's America. So, or ID if somebody not driving. This was very important thing because it saves your life. We have again and again people with blood thinners, and when they fall on the street, what they start to do? Check blood pressure, check a sugar, and they're bleeding in the head. But if EMS come and they see they're in the blood thinners, they don't waste of time for check their blood pressure. They cut them there and do CAT scan. And same, because a lot of people actually dying or going to death faster because of car accidents. And when in a car accident, same story. When the few people, EMS come in and they care about, who's first, who's second. And you can be sitting very kind of okay, just a little bit abdominal pain, but if person and the blood thinners, they see it, oh, she's bleeding in the abdomen. And you go in there first. So it is next what's very important to prevent your damage of your health because you're taking medicine. It's in this one. Next one, I don't know for medicine, but make a question you can ask. Next one, it is control your condition. Like I already said, you did your pages about everything. First of all, it's a medication if you take or you need to take. Second one, you're checking how you control your condition. Okay, if it's a blood pressure, you have to check your blood pressure and you have to have a list of that. I know most of you do, but if you have a hypertension, blood pressure, everywhere, you have to be sure you're doing pulse. When you write it down, like my blood pressure 120 to 60, next number is supposed to be heart rate pulse. Because these two numbers mean nothing without number of your pulse. It is very important. Second one, when you checking your blood pressure, not just writing down, but when you see something different. A lot of machines actually have now memory, and if you know a little bit, you can send to your doctor memory from a computer. It's all this exists. And it's about blood pressure. Second one, you all the time you have a blood pressure, but you have to look in and sometimes you have to pee in the glass cup, and see. And if you see your urine is too like water-wise or a little bit darker, you call your doctor. Now it's actually I don't sell you something, okay? I don't sell it, but I just usually give my patients some kind of strips, and I usually give a patient, they have a system on a phone, unloaded applications, they put it in a P and follow steps, and they say, okay, you're dehydrated, you have low sodium, you have low potassium, and this system sent me notification, Dr. Glusberg, your patient so low in sodium or so high, or dehydrated, so I usually just pick up a phone, like, gotta choose, drink too much or don't drink enough. So everything exists now, control system. So like for hypertension, I cannot say about all disease for today, but generally because everybody almost have a hypertension, is kind of one of reason to be older, because don't be upset about it's normal, aging process. Because like for example, if you have a hole in a garden, you water it, and it's rubber, okay? And if it stays so long in the sun, it's got dry, stubborn, and doesn't open well, it's what's going on with us. If we don't care good about our cardiovascular system, it's got stubborn, and body need to push, is what blood pressure is, harder to go through this blood vessel. So it's actually when we have a hypertension, it's compensation. Our body doing compensation to be sure we have a blood in the brain and the kidneys most of, and heart. So body need to push it. So same story. When we start to control it, we have to find it out. Why do I have a hypertension? What can I do to make it easier? What's wrong with me? I don't walk enough, so my blood from my vein does not go back because I don't move my muscle, or I don't wear too tight things, or I don't know if I don't eat right, and so on. So next on your things, first you put what it is, what you take, how you control it. You're stepping out back and you think, what can I do to make this particular condition better? If you have a hypertension, say, okay, how about if for next 2 weeks I will control how much salt I eat? How if I will see how water I drink? How if I have my arthritis, so I cannot walk much. How about if I can start to do chair exercise? It's million chair exercise on the computer now. Why I can move my legs this way, not walking, but we can raise it up. It's same. So it's called chair exercise. It's a very nice in every way. It's just chair yoga, chair exercise, chair cardiovascular, chair breathing. It's just Google it and you will have millions of them. And that is what we need to start from. Because people say I cannot walk to improve my cardiovascular system. You don't have to walk. It's kind of, I don't know, it's mentality. When we're talking about physical activity, everybody's thinking about walking. Walking is nothing. You cannot lose weight if you walk. How much calorie you spend. You cannot much actually exercise your cardiovascular if you're just walking. Because when we got mature, we're unable to walk too much. Like I was in the military, when I started, I was running. You have to run 2 miles like crazy to be sure you're still officer. And every month was terrible. But then when I got 52 years old, they said, Doc, it's up to you. If you would like, you can start to walk. Fast, certain times, because your joint already not good one, because army would like to save us. We don't care how we are. So it is a big deal. So you, to do your physical exercise or physical activity, I call it, you really same. I start with hypertension because it's very important for cardiovascular system. You need to sit and analyze, what can I do? Not what somebody telling to you. Now actually I work with one doctor, he's doctor of physical therapy. Unfortunately from Mural Inlet he moved to North Myrtle Beach, but I usually send my patients, it's called evaluation and education. My lady, she's 96, she was just so human amazed. But there's many specialists. If you would like to find, you will. So you need to analyze, what can you do? What is your stamina? And now it's a blessing time. Since COVID, people had nothing to do and they do everything. So analyze your physical ability. Analyze what you can, what you like, and what you do. So it is next one. And same about every condition. For every condition you have, you make a card. One thing you say what you have, how you control, so you understand what medicine you take, when you saw a specialist last time, and when you did a blood work last time. It's next question. Because, doctor's supposed to send you regular, but you can imagine, when I worked primary physician, I had 1,700 patients. With all my soil, I cannot follow everybody down. Because it's your health. It's our body, not anybody else. So, you want to be sure you have a condition, diabetes, thyroid, whatever. You just you can ask a doctor or you can Google it. How frequent I have to do liver function or kidney function. Or, for example, if you take lisinopril, you need to every 3 months to check your kidneys. So if you take levothyroxine, you have to check your, not only thyroid, but you have to check your calcium and to be sure you're not doing osteoporosis. So one next question about every condition. How doctor checking you? And don't count on them. You put for yourself how frequent any function of your body is supposed to be checked because you do have a hypertension. I just take it as like an example. So, okay, I have to check my eye, and it's all available. It's not secret information anymore, what doctor only knew. You can even call Medicare, and they send now nurses and they telling you what to check how frequently. And you say, okay, I have to go see my eye every year because I have a hypertension. It can be hypertension retinopathy. I have to check my kidneys every 3 months because I take medicine for hypertension. Because my potassium can go up because I take lisinopril. It's same. I know it's too much information, I'm sorry. But I'm hopefully give you ideas about one.
Just repeat the medication for the kidney.
Lisinopril. Lisinopril. It's a blood pressure medication. But same if you have hydrochlorothiazide, if you have atenolol, any medication which working for hypertension, you need to clearly know how frequent you have to have a kidney function. If you, for example, taking Tylenol for your joint, you need to know how frequent you have to check your liver. Because
liver?
Yes, because for example, Tylenol affects your liver. You need to know, do I have to take, depend how much you take. And like I said, when you make a list and you come to the doctor, doctors know that. When you make a list and question for every condition and separate card, for doctors take 2 minutes to answer it for you. When you're ready, it's readiness, it's like the military again, it's readiness. You have to be ready for the visit. So this one, so it's like we said, medication, control, what you can do for your lifestyle, what do you need to eat, what do you need to do activity. And next one, how you follow up results. It's usually blood work or images. If you have osteoporosis, you need to know you have to do bone density every 2 years, and maybe doctor just forget to order it to you. And about screening, this way, don't listen anybody. Age is not a diagnosis. It's not a cutoff for any preventive medicine. Because what Medicare say, okay, if you, 65 years, you don't need a gynecologist. Excuse me, you have your vagina. It's still there. Maybe nobody use it, but it's still there. So, yes, you don't need a pap smear but if you got a boyfriend, even in the 80s, I see all the time, you have a new boyfriend, and you did not see gynecologist 100 years, you don't forget you have a cervix, but you still do. And you got a boyfriend, you have no idea what he went through his life. Mm-hmm. If you have a new boyfriend, in a year of relationship, go to gynecologist, say, can you please do my pap smear? They say, oh, I said, no, you have to. It's like example. So same. And even you don't need a pap smear, you have your somebody or nobody use it, nobody touching you, but you still have it. And we still have a cancer in vagina, we don't use it. And problem is anything inside, we don't feel it. So every 3-5 years, you just go to the doctor. You don't need all this scrubbing, pap smears, but somebody needs to look in it. Because even you take in mirrors, you don't see it. Because it's somewhere. And when you see any family physician or nurse, or you can do any place at God, please, look inside. What is there? Because any cancer of vagina or cervix, very easy preventable. Yeah. They just take off your piece of meat and you live 10 years. And same about mammogram. It's no official cut off. Your insurance will pay till you live. You have to do mammogram every year because it's very easy to treat. I have a patient, she was, I don't lie, but over 90. I don't know, 91 or 92, as my oldest. Skin cancer, breast cancer. This was a few years ago, she's still alive. I sent her for mammogram and they find it like pea size next to nipple. They even did not remove her boobs, she didn't do any treatment, they took off this cancer. She still lived at least 4 years because I'm 3 years old, yeah. She's still alive. And the whole point is, death from cancer, like I said, I see 2-3 deaths every day as a hospice doctor. Death from cancer is not easy death. And doesn't matter you 80s or even 90s. You paid enough of taxes and you need to go. Nobody will send you. What we talk today, what you have to do. Don't count. Because when you got like close to 70s, I can say this way. When you're 70 or 75, if doctor will not send you for mammogram, they will not punish. Doctor sent you for preventive care because they will punish by money. Because if they don't send a patient with 50 years old, certain percentage of patients for mammogram, they just will not give them bonus. But you're already out. So if they don't send you for mammogram, or they don't do a gynecological exam, or don't send you for colonoscopy, or now it's easy for Cologuard, nobody got punished. So even if you will not ask of preventive care, nobody will do your preventive care. And it's so easy, I know you won't remember, I took too much talk, and I understand that because I would like to orient you, make you worry. So you just Google preventive care for cancer, and they give you whole list, but don't look in what age. Preventive care, because when they created this guideline, it was like 20 some years ago, and they say, oh, okay, lady after 80s, it's only 1 of 2,000 will have a breast cancer. You know it's not you 2 from these thousands. I know anything 1 of thousands mine. So it's what I know about myself. So you say preventive care. I give you just a few examples. But like they don't want to send you for colonoscopy in certain age. Okay, say give me Cologuard. Insurance pay for that. There's no cut off by age.
The alternative.
Cologuard, when they send you shit, they give this, it's on the TV all the time. They send you a box, you put your shit and you send it there and they tell you. Every 3 years and you save. If it's come positive, you go to do colonoscopy. I had, even these 3 years, I had 4 of them positive. One guy had a pre-malignant polyp, since got not a cancer, but pre-malignant, so they removed it, hallelujah, and he's old. But anyway, so it is next point. I hope I explained about diseases. This is about prevention. Make a list, what you need to do, how frequent, put this in your calendar, and be sure you follow. And you just tell a doctor. They can say, oh, you don't need it. Say, doc, I have my Medicare. I still have my brain, and I don't want to die from cancer. When we're talking about age and maturity, we cannot avoid the cancer. We can delay it, or we can find it in the early stage, and we can easy to fix it. Now, since that we can easy fix it, doctor know how. So it is the next topic, to be good quality of life. And don't die from things what you don't have to die. Absolutely not in certain age. And how we now. This is what kind of medically wise. If we're talking about socially wise, first of all, you have to let go everything. I know it's hard, I'm working on it, doesn't work yet. So you need to be sure you're selfish now. You have to be absolutely selfish. Good way. You have to understand this way. When people say, oh, I worry about my kids, grandkids, okay. You only can worry about cat and dogs and flowers. It's allowed. Rest of stuff this way. You have to think, oh, I did not call my daughter because I'm sick, because I don't want to bother you. If you bother her now and she put you in the hospital now and fix you, it's cool. They must do, you change her diapers, okay? Why are you worried to bother them? You change their diapers. They have to. Plus, second one, it's like social things. Second one, you maybe have a high blood pressure. They put you in the hospital, they control your blood pressure, it's fine. If you will not bother, whatever your loved one, even your husband, somebody even don't wake up a husband who's next to, it's again and again and again happen. In a few hours you will have a stroke. And they have to take your shit after you for the rest of your life. So you're not doing anybody better if you don't want to bother them. You deserve to bother everybody around. I all the time say, and I even show to my patient, you're not a princess anymore. You're a queen. You are like, this queen in Britain, Elizabeth. All the time when you don't want to bother somebody or asking for the help or whatever. Like I say, you decide to do something yourself, move something, your chair. Don't ask your daughter. You fell, broke your leg. How many trouble you give to your daughter? She could better to stop by, spend a couple times, drink a tea with you, move your chair for 2 minutes and feel about yourself. I'm so good, I help you, my mom. You make your loved one proud of themselves. You not bother them. You like was say when my mom asked me something I did, I said, oh my God, I'm so good. I came one time early from the job to take my mom to the doctor. How good daughter I am. Even you don't think consciously, you make so much positive emotion for your loved one, husband, friends, whatever. If you help to each other, I'm sure you say, oh, I'm so good, I took to the doctor or take to somebody. But you need to change your mentality for your social. You do need help. First, period. You do need help. You deserve a help. And you must ask for help. I tell everybody, you have to make a list. Same thing. Make a list about everything. You make a list. What do you need to help you with? I had one lady, she still saying me thank you for many years. She got kind of mature. And she's still cleaning her house. And we talked to her, she's one time almost fall and everything, said, why you don't hire anybody? Oh my God, I can do myself, I don't want somebody to do it for you. Say, okay, think from another way. Let's say some poor lady has a kids and she has no money to buy them Christmas present. You hire her, you pay her money, and you will make her happy, this lady, because she has the money to buy a present for your kids. And you make happy kids because they have a present. She was looking at me. I never thought this way. Thinking this way, you still have enough money. You can definitely have to see a list and make it what you need assistance for. What you don't scare, do something what a little bit hard for you to do, to give it to them. And you're doing something, and you go into Brooklyn Garden and let her clean the house. It's going to be help for all of you. You will not take a risk to, got a vacuum and got your shoulder pain. You will go to looking at the flowers and enjoy it, and your blood pressure going normal, and you will feel good, and you take your friends and have a tea. And this lady will have $50 to buy candy for the kids. And you will be proud of yourself, how good you are. You open workplace and economy going up. So, try to realize your social life. But same, not like, oh, I think about this tomorrow. You're not princess anymore. We don't have to think about tomorrow for social life. You take a seat and say, okay, I have a friends. When I give the card to them, thank you card, love card, whatever. We need to write every day, every day. Best way to write, because otherwise we cannot open, we lost our motor skills. Every day you have to go and buy dollar store a lot of cards, thank you cards, happy cards, birthday cards, Christmas cards, whatever. And you have to write, because you can write the letters, but nobody does anymore. So you take a seat and not a computer, send an email or text message. You're physically writing. It's very helpful for brain, eyes, ears. You can even talk to yourself. It's very, very helpful, by the way. It's okay to talk to yourself. If you don't have a cat, talk to cat. Or flowers. My mom talked to flowers all the time until she died in 91. She was talking to the flowers. We actually made a garden for her. She has somebody to talk to because we're in job. So, and it's okay. It's fine. It's completely normal. So, and every day you have your time, tea time, you got your tea or whatever you drink, water, you take a seat, got a pen, got the card, and do it at least one card. If nobody birthdays, nobody Christmas, you can write about thank you. My classmate 20 years ago, thank you, we had a good movie when we've been 20. We'd all go and drive through movie and we so enjoyed. Do you remember that? Maybe she's in nursing home, who cares, but you write notes for her. And you make her happy and you're proud of yourself. You need to write, sorry to repeat, every day, whatever you write. I have one lady, I talked to the, because she made this movie about it. If you have a love grandson, who's small, or whatever, some love one, and what you can do, you can write a card for birthday, up to whatever, 21 years old. Just every day you write, happy 2 years old, happy 3 years old, and when you got 2 weeks, you give it to your daughter or son, and they will give it to them in a birthday time. You can also do Christmas card for your loved one, like you have your grandson, okay, you can write him letter up to wedding, happy wedding, and tell your son, okay, it's a box, it's my card, and you see this whatever year, whatever day on the top of the card, please deliver it to them. We will have your emotional connection, not only now, but from there. And it's very helpful for you because it's give you positive things. You write in it, you thinking it, it's your feeling. I'm telling you, big problem for elderly people when you were old, they lost emotion. It's what like flat effect. It's the biggest problem. They lost the connections. Your brain losing connection because our brain created up to 55 years old. After menopause, God turned us off. I'm not much religion, but I don't argue. Maybe God still care about our spirit, but He doesn't care about our brain and about our physical. After 55, after menopause, whatever it is, time, everything conscious. And one of things, not the medicine, but emotion, you have to keep your positive feeling. And if it's not because, oh, your spirit, no, it's for your health. Other way, in a certain age, you got flat. And I see this again and again when I visit my patient for hospice. And definitely, if you're sitting like that, flat, no emotion, who will like to care of you when you got old? Nobody, even nursing home. But they demented, happy, we call it happy dementia. When people even demented, but I'm sure you saw these ladies, they smiling, happy, they hugging everybody, they still positive. Everybody like to help them because they're positive. But you cannot just be that. You have to work in it. This is very important. Definitely you can make a list of your friend. And we have a tendency kind of distance. And it's kind of expectable because we don't have so much emotion every week. Always think, oh, I don't go to lunch with my friends today because I'm working so slow. I will slow them down. Or I eat not nice or whatever. We find excuses not keep connection. It's a worst can happen with us. You need to have you don't laugh at me, you have to have a list of your friends. And you need to be creative. You're not waiting when your friend is calling and invite you, I don't know, Brooklyn Garden, beach, whatever place you like to go, library, book club, whatever. You need to say, what can I do with this particular friend or neighbor or my daughter? It's a keep connection. Nobody will do it for you. and it is your health, and it's your aging, and it prevents your loneliness. You need it, because nobody will do it for you, only ourselves. And same with your relatives. Everybody knows how to do FaceTime now, or whatever you use, WhatsApp. You need to be open to your, whatever, whom you have, loved one, nephews, everybody. Same thing, you have to have a list of your relatives. I'm not joking. Because unfortunately, if you die, they need to know whom to call. And it's very big problem for hospice. We just, people dying and we have no idea whom they have. They dying lonely, we just could not find daughter. We know lady died yesterday, by the way. We know she has a daughter, we could not find it. Today with nurse, they start to do investigations for police. No, it's disgusting. So you have to have a big list of everybody with a phone number or address, whatever you have. Because when you will do letters, you will have to make a list. Whom you have your life, who need to know, excuse me, about your death or your sickness, or just write a letter to whom. And everybody who able, as example, when my mom was here, she didn't speak English, definitely. She got over 70 here, and she lived with me up to 91 in my house. She said, I live with her, and I'm fine with it. So what we did, it cost us much efforts, not money much, but efforts. We called her friend, she was a friend back to Siberia. And we started, she was 80s. We called her, we asked her family to buy her computer. And we didn't have laptop like 15 years ago. Buy a computer, and her daughter and myself, we taught them. In the beginning, we sit next to them. Finally, they learn it, even over 80s. And every Wednesday, we got a later time because it's Russian, they talk. They talk hours. Hours, and it's safe. I talk to my families, for my elderly people. You need to have a schedule, and you have to talk to your family and say, every whatever Tuesday, Wednesday, and it's good for them, not only for you. I talk to my one grandson. Next day, I talk to another, FaceTime. Another, and no excuses. They must do it for you. If you have a 30 of them, it's one time a month. If you have 3 of them, excuse me, twice a week. But you have to have a list, and you have very strongly, I say you have to be self-efficient queen. You very strongly need to talk to them. It's also a good one, because when you start to talk to them every day with somebody, if you talk wrong way, or you look strange, they will notice it. It's about health, it's not only sexual. I have a lot of calls when family call me, you know, Doc, can you go to visit my mom or call my mom? She talks strange today. And I call and we talk and we find it out she has a problem. So it is social, it's emotional, it's good for them. You don't bother them. They're proud, and they will remember, like boy for 10 years old who see you one a year, maybe not, from Michigan, and you talk to them 3 times a week, or okay, months, fine. And he will remember you, and it gives him very warm feeling, because he had his his grandma, and he know who you are. Because parents busy, they don't know how next Christmas coming, and this Christmas now we're going to another parent, and it's okay. They have a life, but you build a connection, not them. If it don't happen from first time, be annoying, be ugly, but do it. Just openly talk to them. Say, I need somebody see me, because they can see difference of your face and call a doctor you had a stroke. Because people can have a small stroke and don't notice it. They can see how you mentally, because if you repeat same question twice, this boy says, Mom, Grandma talking funny today. It's happened again and again. It is your guys, not the doctors, who see you twice a year. It's your family and your friend. If some friends far away, You put them in a list, like I tell about my mom. You put them in a list. And be annoying. It's okay. It's fine. It's okay. Try to find the time what's good for them because you have whole time in the world. But do that. It's a social things, which absolutely necessary. Absolutely. I talk a little bit about physical, but I repeat one more time. You need evaluation from professional. And they have to make your physical program. And I know everybody can do that. Everybody. People in the bed who's bedbound, they can do it. So, but you need to know what and how. So, it's about this one. I don't talk much about diet because when people come to me, what is healthy to eat? Everything healthy to eat. But something healthy, seafood healthy for you, but not healthy for people with gout. Okay, I cannot drink grapefruit in the morning because I'm taking thyroid medication. But I can take it in the afternoon because it's 12 hours after I can do that. So it's very, very personal. Invest your money and have a food sensitivity test. You need to know what you digest proper way. Because, for example, I did my food sensitivity like 9 years ago, maybe more than that, because I could not lose the weight and I ate so healthy. And I cannot, it's amazing, my body, I'm not talking about allergy, I'm talking about digestion.
Okay.
For example, I not digest spinach at all, and I'm doing my healthy drink every morning. And it's me, for example, I cannot eat almond. I can eat almond, nothing happen. But it's nothing happen with almond. It will be spoiled, give me gases, be ugly, give me leaky gut, and I poop it out. No, even it's very healthy things. Some few more things I cannot. But since I got to America, I changed my spinach to baby kale. I hate the kale, but baby kale is fine. I changed some beans to another beans. And my brother was angry at me because he got older. I pushed him, and he did a food sensitivity, and absolutely his body not digested avocados at all, and eggs. But his breakfast, half of avocado and eggs, because it's so healthy. Yes, it does, but not for him. He stopped to do it, his allergy go down, and he got the vitamins. Because next question, people ask me, what vitamins healthy? I don't know. Your vitamins, one, mine, another one. I can tell you this way. Multivitamin is a shit. Waste of your money. No, I mean, if you don't do something better, okay, take it. But whole point is, it's like you taken a lot of iron, whatever, something, and drop it. Hopefully one of them got us in a target. It's what we did with vitamin. Multivitamin will create a long time ago when we had no ability to check what we have a deficiency. We do check in patient for deficiency. Patient come, I have a picture, but it's okay. Like 15, 12, 20 bottles different. One guy came, box of bottles, supplement the vitamin. Every supplement is good one. Everyone. I sell it, I have big inventory, I'm fan of it. I love it. I treat hyperlipidemia with supplement, I treated, sugar with supplements. But whole point is he came to me with these little bottles, and I was like, okay, fine. This give me neighbor, this Costco was on a sale, this I saw in the CVS 2 for 1, this is my parents, this I read it about, it's for heart, it's for whatever. He has excuse for everybody, and I agree with that. But I said, look at him, one question, how are you taking all of them? Physically, how you can take all of them? And it's as funniest about supplement I ever hear. He said, very serious face, and he's not demented, 60-some years old, very intelligent one, and he looked at me like, it's so easy. In the morning, I do protein shake. I said, you short of protein? No, it's good. Maybe, but it's wrong for your kidneys. Okay, you're doing shake, and what next? He's taking all these capsules, put this in a shaker, and make a shake with all these 20-some supplements and vitamin and drinking it. And I'm good for whole day. Okay. So can you imagine? It's what people do now. Because yes, we did not care about health, now we over care. We had another guy, he just came recently to me and said, oh, you're in Iraq, I did a blood work somewhere. Because it's a lot of offer. Oh, we can check everything for you. They check everything. Said, you have a copper deficiency. COPER, copper deficiency. That I need a supplement because I could not find a good one. I look at him. Okay, show what you have. He showed me a bunch of bottles. I said, let us calculate. We calculated. It's example. It's not only that. It's a lot of different example. We calculated with him a zinc. Everybody crazy about zinc now. You know what I'm talking about, eh? Z-I-N-C.
Oh, zinc.
Yeah. Everybody crazy about post-COVID. We calculated with him, he's taking 200 milligram. I look at him. Maximum you can take 25. You're taking 200 because every bottle has a little bit because it's healthy.
Right.
And he has all these bottles. Look at your supplements. And every bottle has 10 milligram, 15 milligram, 20 milligram, 25 milligram. We counted is 225. And what's happened in the body when he's taking same. It's I can talk about every vitamins, but it's because everybody knows this mineral post-COVID. It's very healthy take when you have a problem, but you need to know how much. Then, if you take in more than 50, what's happened is block intestine and you don't absorb a copper.
Right.
You poop it out. So you have bunch and bunch of zinc, you don't have a copper, your blood suffer, your neuropathy, headache, it's millions of complications, we have a copper deficiency. And what they do, they come to me to fix a copper deficiency. They said, how about if we just stop to taking zinc? He laughed and looked at me like I'm a crazy. What I usually do, I just have my iPad next to me. I just Google it, look at it, read in English. You don't understand my language, look at language. He, oh, yes. Anyway, in the 3 months he came back, everything is fine, Cooper is okay, because we have it. Generally say, regular American who taken nice nutritional food, according whatever you can digest, you really don't need much vitamins. You can have a 2-3 deficiency because degeneration, absorption, leaky gut, whatever. I had mostly my patients that when we do it, last patient was bunch of it, we stopped it in 2 weeks, did a blood work. She been deficient A and E, 2 vitamins, and selenium. Selenium most likely because with our maturity, sometimes we don't absorb, but she didn't have enough Brazil nuts, she didn't eat or whatever. We fix it, but by diet first. And these 2 vitamins, why they didn't have it? Because they said, okay, you need a metabolic analysis. We did a metabolic breathing test. We did a breathing test, and breathing test showed how much fat she needs to have. Good fat. Fat is good. God created everything for purpose. Cholesterol is great. We don't have to have too much, but we cannot be without cholesterol. Right. And she, because she's super healthy, and I don't want to argue. I just do tests and show numbers. I show them. You see how much fat you need to have a day. She calculate. She had just less than 50% what she needs. So vitamin E and A, she really doesn't need a supplement. I give her for a few months until she recovery. You cannot get vitamin A and E in your body because they're supposed to be in fat. It's oily vitamins. Body does not absorb it if you don't have a fat. Are you serious? I have to eat fat? Yes, girl. You do. Another story, you have to eat a good one from products which you can digest. It's another story. But you do need it. So you do need to know whatever test you decide to do. It's better to do tests for, like I said, for nutrition, what you can digest, what you have really deficiency for before to buy it. All this spend $500 a month for supplement. You spend $5 or whatever dollars, $100, and check what you actually need to eat. Because, like I say, I'm a very bad business girl. I have to sell supplements like everybody does, but I'm better as less as possible because it's not my business. I sell it, I supply it, but it's not a business. It's when you have no choices. Okay, so you need to have a test, and there's millions of tests now, and even here it's called metabolic test, metabolic assessment. I do breathing test, another doctor doing another test, and this test for 10 minutes or whatever they do, they show I have two different one. I do calories, it's a Steico machine, and I do breathing test because Steico only show calories. But calories, it's not enough. I would like to see protein, carbs, and fat, how much we need. And you can calculate maybe week 2 and see what you actually have. You can do it in a program. It's a lot of free stuff. I have one lady, she has it's help keep connection, by the way. She has a wonderful grandson, far away. Every day she sent him a list, what she had for the day and how much. And he put an application, and in the end of the week or month, whatever, he give it to him, Grandma, you don't eat enough protein or calories. And this make him proud. He's so great grandson, and take it 3 minutes from him. I mean, suppose, nothing to say, I cannot do it. It doesn't have to stop you. You can find somebody around who can. Okay, so it's about food. And then when you know what can you eat, what you can digest, what you need to increase in your food because you lower selenium, for example, or whatever, vitamin B6 or anything else, most of them we can find in the food, only vitamin D in the sun, that's it. Then then you can talk about diet. Rest of stuff, if you go to nutrition and he will start to talk to you what to eat, don't pay them money. They're liars. Nobody knows what you particularly can eat. Nobody. You can, if you cannot do it, be some kind of little bit approach from your medical condition, not from whatever healthy. If you cannot do test or you did not do your test yet, looking on your medical card, what we've been talking about, and see what's good for for thyroid, what's good for hypertension. But even this, I can say you, if you eat too much seaweed for thyroid, you actually give opposite things and body stop to work. So it's all very complex. You need to know who you are from nutrition's point. Yeah, it takes time, but what to do? You sell fish, your time is yours, your money yours, invest it in your health, do good evaluation, and then you're doing good nutrition, as less supplement as possible. You will need it most of the time. Some people need a B12 injection or something else, but even B12, by the way, don't do, B12 help. I have a few patients who came from some wellness centers because they do B12. You can go to a mall and they can do a B12 for $20. By the way, if you have anemia, insurance covers it from your doctors. It's actually free. But whole point is, a lot of patients have too many red blood cells. And if you have special conditions, and that's not very rare. And if you have too many red blood cells already, because people have anemia, but they can have opposite condition. Yeah, and you had a B12, you have even more in the clots. So supplement and vitamins is a dangerous substance. It's people making billions, good luck. They can go to Hawaii, but you can go to the hospital. For simple things, you take in, for example, not you, somebody can take in Coumadin, blood thinners. And somebody said, ginkgo biloba, so good for your brain. Or you buy some kind of brain supplement, and ginkgo is there because it's most important. Yes, it's good, but if you take a Coumadin, your blood has got thin and you have a bleeding and you die. You did not die from supplement, but you die for interaction. My whole point is, supplement is not just do it. It can be very helpful if it's yours particular, or it can be very bad. And now it's so many of them, maybe too many. Same like I already said a little bit, try don't supplement your food because it's so important. I have a protein too, but Because, oh, you have to take proteins. It's not all the time okay, because maybe you already have too much protein, and it's happened with age. And if you take in too much protein and you plus protein shake, protein bar, protein whatever, and your kidney got blocked, good luck, hallelujah. So be very cautious about what is, you have to check internet, but like I already mentioned, don't start anything without asking medical professional who knows you, not just, oh yeah, it's healthy. I can tell you protein is healthy, I have it, and I do patients. But for now, for example, instead of protein, you can take amino acids and build you. It's a lot of things, sorry, too much. It is about your nutrition. Then you can, I hope it's last one, or you can ask. And last one, people say we got older. Looking. You have to have a nice care for your skin. Especially not for face. No, for face too, not only for face. We have a 20% of oxygen through our skin. And I do skin exam because I'm, say, a dermatologist. And when I do skin exam for cancer, I touch in this skin, oh my God, I don't know how they touch themselves. Skin is so dry. And what happened, yes, it's normal aging process, what I don't like, but it is. It's expectable. So, because our blood does not push enough to feed our skin from inside, we have to feed it outside. So simple. Invest in yourself. You have to be smart approach. You need to read about if you're able to go to the bath, safety-wise. Generally say, I can tell you about house a little bit later. It's going to be my last topic. And if you able to get bath, you have to do salty baths at least one a week, because you
Salty bath.
Yeah, I'm doing internet, I buy in Dead Sea for myself. Like I say, in 50 years old, I understood I'm going old at some point, so I don't want to. So you're doing salty baths, it's salt, and salt got the water, because it's salty, attract water. And salt has a millions of effect. I don't have a time for that for you to keep you here. But it's just simple things. Oatmeal bath is very good. Everything good for kids, good for you. Because what we're going from diapers to diapers. So people say, if you don't want to buy good, I buy for myself, I do patients, it's stimulation of stem cells. It's maybe expensive, but it's not, because how you use and say, we made a deal. All money you have, it's for you. It's not for anybody else. They will make, anybody around, they will make money. Your money for you, for your health. Because if you don't spend the money for your health, your money will go to somebody because you will die sooner. Or you will spend it for 24 hours care.
Yeah.
And it's cost $24 an hour. Now, so you have to find a way, same, you can, it's one of your health assessment, you put this in a card. How's my skin? How's my hair? How's my nail? But skin is first. And not your face with your wrinkles. I really don't care about this part. I do have it. I don't say I never will do Botox or whatever. I don't do it now, and I'm so against it. I have my medical issues for that. Maybe I will need at some point if I don't want to be ugly. But so far, fine. I'm okay with how I got older. In my 62, I'm satisfied so far. I do cream, so be sure it's not look ugly, but wrinkles itself doesn't bother me yet. But anyway, but skin itself needs to breathe. So you need to assess how's my heels, not because of pedicure, but just because why it's dry. How's my elbow and everything else. You do assess. If you have any lesions, benign, spend your money, remove them. Because if you have a skin text, it's virus. It's not so benign that you go to doctor and they say, oh, insurance doesn't pay for that. I said, why did I work so much if I cannot pay to remove my ugly pieces? Why did I work for so long? Because you have so many, people have so many tags, it looks all benign. Yeah, it will not give you cancer, but it's virus. And it's still in your body, you don't need it. And they look ugly. You don't have to feel yourself ugly. And you have to satisfy yourself. And plus, you can scrub some lesions. Yes, it's benign, like seborrheic keratosis. And if you don't care how it looks, you can scrub it, infection can go in your body. Because it can be bleeding or whatever. So skin is very, very important. Because skin is the biggest organ in the body. And how you look is also satisfied you. So, but be very cautious why I'm doing this topic. Be very cautious about millions of procedures now. Try to find anything non-invasive. All this microneedle and all this stuff, anything what, I don't say don't do that, it's your choice. I'm telling you my personal opinion. I can make a lot of money in abundance, but I know what side effects we can have because we paralyze. Why we have to paralyze ourselves? To look good. I would paralyze. Okay, fine. And same with fillers. It's proof already if you do fillers, it's change in, you know, all this electricity around that's not good. And when you had a buttocks or something foreign in your face, whatever doctors give you to look smooth, it will increase absorption of electricity and influence in your brain. And you will come be crazy, you can be looking good, crazy girl sitting in a chair. So it's unfortunately a lot of things. Be very cautious what you're doing for yourself to look good. You have to, it's help us to feel good. You can't do that, you like brows and nose, whatever you do. You need to have a good care. Don't save your money. Don't give a present for your grandkids. They don't care about your money, especially about presents. If you give them $5 or $10, they don't care. They need a 500 anyway. So make them cookies. They will be more satisfied. And spend the money for your care. And it's seriously. So next one, you make a choice good, healthy products for your health, for your hair, for whatever you like to correct. If you buy lipsticks, you not buy lipstick whatever you see. You have to find the best one for you. You can Google it, you can go talk to store, you can go to talk to, you know, professional, whatever. And same for all your care, because whatever you apply, even sunscreen. I did a big, you know, evaluation for sunscreen. Most of sunscreen actually don't help you prevent the hair cancer. They give you skin cancer. Because they have, now it's proved, and some brand is actually recalled because they have some chemicals which actually promote skin cancer. Good luck. And they're also toxic for you. It's very few brand relatively okay. I work honestly say only with one. Maybe also not at it's not a bread and butter or not a Vaseline, but it's better. Now they're talking more and more about new brands because anything you apply on the skin, it's got in your body. So be very cautious. What do you buy? Don't do investigation from your friend, from family. Do conscious decision. Now you can, same, you can ask your granddaughter or daughter, a simple application. Before you buy something, make a picture of the label. Send to your young one. Or, by the way, guys, all of you young enough to learn it. It's so easy. It's a free application. And your application say what dangerous things inside of product you're going to buy. So it's all available. And I really advise you to work with computer and social. We have one dangerous thing, it's called TikTok insomnia. If you start to do TikTok and you don't sleep until 3 a.m., we, between doctors, we call TikTok or Facebook insomnia because people just frozen in it. So you have to have a strong limit. Okay, some ladies do because when husband got crazy about internet, they turn off internet in certain time. You can program it. Internet is gone, you sleep. And better to read a book. paper book before you sleep. I don't talk about sleep because it's completely different lecture. It's too much things. So, but social learning computer, better definitely computers than phone because it's bigger and you see clear, but it's very healthy. It stimulates your brain. But my last tip, 3 tips what how to keep yourself healthy. First of all, go to dance.
Go to what?
Dance. Dancing.
Oh,
Anyone, even you have this, you can dance at home. Some in a chair. They have dancing in a chair. Online. Dancing is the best to prevent, it's official. It's Hopkins, you can Mayo Clinic, you can Google. Government actually secretly spend the money for that because they open dancing studio for seniors in a senior center, even for free, because then they save money for nursing homes. Because if you dance, what you do, it's the best exercise first. Okay, it's the best exercise you're doing, physical activity, and it's not boring, so you will do it if you like it. You have to find out what dance you like. I say up to chair dance or water dance, whatever. Next one, you listen music, so your ears involved. And doesn't matter if you have an ear device, you hear it. Second one, you see because you're looking how people move. You move and you keep connection. Most of the time it's connected dancing. But even you in a circle, you keep connection. And your brain supposed to correlate all these things and brain wake up. Because we usually use for end of our life 35-40% of brain maximum. 60% new, very wonderful brain we die with, never used, which is wasted. It's why it happens, for example, when patient had a stroke and they do rehab, learn how to read, right? They don't activate what brain dead from stroke. It's dead, it's gone. We activate a new area of brain, and most of the time very successful. But what you can do when you use a dance, you not use your previous one, which you used for 60, 70, 80 years, you activate a new brain, new cells. You let them to work. And good one, because it's not just thinking. People say, oh, I do puzzle. Leave me alone, throw them away. You can do it, okay, if you're nothing to do. But it's a recall. What you doing? You try to recall what you already know. Plus, when we got older, actually our memory from longs, it's okay. We remember our childhood, we don't know where's our key, and you can find them in the refrigerator. So, this happened. So, it's okay to do puzzles. I think people who making them, they just create this story to do that. Anything you do for recall, even Sudoku, whatever, it's okay to do, keep yourself busy, but it's nothing to prevent a dementia. Because it just train your long-term memory, so you can remember how's your grandmother name. But you will not remember how your grandson name, because you're doing puzzles. So that's not related today. To be sure, you activate your brain. First of all, like I said, dance, because it's better in the first place, because it's also memory of motion. You're moving. And balance, because what people die a lot of percentage, they fall, break a hip, dying in the next 5 years. You need a balance. How you can make a balance? Dancing. As sooner you start it, as better. All people use it. If you see traditional, like history of medicine, everybody dance. Every nationality had a dance, and they dancing regular. Weekends or holidays, we don't anymore. It's crazy, because everything people did historically it was for health, to save national ethnics. But anyway, it's a dancing. Second one, if you have to be smart, like me, I'm just kidding, but you understand why. You need to learn language. Because then you can learn anything. Because it's and government knows it, but they don't do big deal about it. But I'm jealous for you, I'm 62, I cannot use it. You can learn anything for free. You don't need a scholarship. Every college accepted 65 and older for free. You can learn politics, you can learn history, you can learn how to make quiz, you can do anything and everything. You can learn how to write a books. I have a lady, she started to write 85 years old. My patient, real patient, is still alive. She's 97 now. She has so many publications, she translated in 120 countries. She started to learn, I know a girl, she started to learn how to paint. I actually have a picture, she present to me. And she was 80s. She got the classes, she painted. So, and you guys can learn anything for free. But if you have a choice what to learn, you need to learn a language. One lady say to me, I start to do French. I say, why? And in my bucket list, I would like to go to France, and I would like to say at least hi, bye. And don't be frustrated, don't use it for competition. You can never maybe learn Russian, but if you start to learn it, you delay your dimension many years. Same story, when you learn a language, you listen, you see letters, you write it, don't do computer-wise, write it. You write it, you talking to these guys, and you can go to classes, or you can do in a computer's million program, or you can gather two of you. Okay, we're going to do whatever, Spanish, any weird language, Japanese, whatever. It doesn't matter what you learn. Learning process activate your brain, because you telling your brain doing something what your brain never did. This activate your brain. You not recall, because hopefully nobody speak Russian in childhood, so you don't recall it, you learn it. But I say, you can learn anything, but if you want to dedicate your time, learn languages. And I know, I don't know here, but I know it was government program to do classes in a senior center for languages. Just go, it's a fun. You will cook some dishes from this country, whatever. It is two things you can start tomorrow to have your quality of life, because biggest concern is our computer. We can have a perfect health, but if our computer is broken, whole system down. It's done. Because, like I said, I don't want to be happy demented looking in the window. They have no idea how's my grandson name. So start from brain. I finished to this point because we usually remember what the last will say. So you start to think from here, go to down, and this will help you. And you can help yourself, nobody can. Or you can create a club. And you can make, okay, we do club, whatever girls you are, people have clubs in the neighborhoods. I say, whatever topic you find today, whatever we discuss, whatever. You can, and I can tell you can also find the doctors whom you can invite, or any kind of specialist. Everybody like to come and teach you. You can filter it. You can see if it's true. And it's kind of wellness club you can do by yourself. You can do together. Oh, my doctor said, it's absolutely healthy to discuss your health, but not complain about your health. It's annoying. But you can discuss wellness. You can, but same. Somebody say, okay, this vitamin is so good, I take and feeling good. It doesn't mean you're going to buy it. You can review from your perspective. God is critique and conscious. And maybe it's good. Send a doctor message, okay, I'm taking so and so medication, can I take a vitamin B? Oh no, you cannot, you have too many red blood cells, so whatever.
Right.
So it is what you need to do. And I'm so apologize I talk too much. I love my topics and I can try to be short, but I cannot. I give you like the top tip of iceberg. But if I don't know, usually when I talk too much, people don't know what to ask because I already overloaded. You know, I all the time say, I have overloaded dementia because I know too much. I don't know where to start and when to finish. So, okay, ladies.
It was great.
Say me if you have anything particular, I can answer any
We
question.
need to move our bodies because we've been
You
sitting.
have to.
We've been
Yes.
sitting so long.
Yes, so as
It's
was I
not
say, I
good.
usually say we cannot be in position hour and a half. And I was looking at it here because we start 5:15 and then 6:45. But about moving, okay, I never finished. I'm sorry, the last 2 minutes. You need to understand, when you can stand, you can walk, you need to understand one small things. You like old phone, all of us. We can ring, we can talk, but our battery is so low. So we have to recharge ourselves. You've been absolutely right. When you're home, you're doing nothing more than 30, 40 minutes, one things. You're doing dishes 30 minutes, you drop it, whatever you didn't finish, you go load it, laundry. Then you're going to do something else. You have changed part of the body. Even talking, I talk more than I'm supposed to. I'm supposed to talk just 40 minutes, not more than 30. Because we're able to concentrate in one activity not more than 30, roughly say 30 minutes. Then we have to change activity. It doesn't mean go to lie down, or I'm going to rest. No, you don't have to go to rest. You have to change your activity. If you did something by your hand, doing something by your leg. If you've been thinking, you start to work it. It is a big, big things. So it was you need to do. Okay? Yeah. If you will have any questions, I have a website and I have contact us. My people type me letter all the time. You can type me letter and I can answer. I did this mistake. I don't try to be, I know, and I didn't ask you names. Sorry. But what topic, generally, what big topic you would like to, we're going to do some, I'm moving, by the way, I'm moving my office. I already sold this one. I'm going to Murals Inlet. I already bought the office in the Murals Inlet.
Where?
Vacheso Road, you know Vacheso Road?
Yes.
And it's gas stations, 3 gas
Oh,
stations.
yeah.
And just behind is, so far it's yellow building.
Close to the hospital.
Yes, but it's just there.
Okay.
But I don't know what color it will paint, and so far it's yellow building, just behind the gas station. So we're there. But whole point is type it me later. We're going to do more, I hope I will talk online. And I can do these topics, whatever people like. So, and I like to read letter, people type me too, and you know I'm easy to reach. And
She responds very promptly.
yeah,
How did you find out about it?
She was my physician for
we
many
know
years.
this lady
Oh, she was a physician.
for many years, for many, many years, and I know her son and grandson and daughter-in-law. I said I was in the Murals Inlet from 2009. I was a physician there. So I still physician, but not there, coming back. No, I moved from Murals Inlet because when I started to work with Grand Strand and tried to open wellness clinic, they had non-compete and I cannot open clinic 10 miles.
Oh.
So I moved this not because it's so hard, parking and everything,
Yes.
but I moved here because I didn't have a choice. Now it's 10 years gone, so I sold my wonderful building and I go into back to Murals.
It's been 10 years?
3.
Oh, okay.
No, 3 years. 3 years ago. 3 years ago. So, and I go back there. So we will try to do more seminars. We're going to be online education. Like last, my education was about don't use a scratching pens, and you know, because you can do heavy metals. Check your kitchen, throw away your old ware, cookware, because it's so dangerous. This was my last topic I talked about. I talked about a lot of different things. And like I say, and if you would like to know something, you can send me that, tell us about that. And I will do presentation online and tell about whatever you ask. So unfortunately, I know too much. I need to share.
I need to use the last
Yes,
one.
it's my bag. By the way,
Me too.
I was bad girl, for when you come. I really, it's here, I open it. So,
Get it?
I hope
Never-
you didn't roll out of the view of the teeth.
oh, I have to show you. I didn't turn it down when people have hearing aids, it's not good. I have a very nice piece.
Oh, my battery went dead while you were
I
talking.
know, but I know. Look, but
If this is rolling up, then you need to
Oh,
go
how pretty.
bathroom when you see
yes,
that.
when I have this piece, but it's kind of make a little bit noise, so when I talk, I usually turn it on. But it's just, by the way, buy for yourself running water in the house. It's very easy to buy. It's very easy to install. Very easy. This piece costs less than $1,000, but you don't need a big one. You can have a small one. You have to run in water in the house.
Thank you.
Yes.
Too bad shoulders, reverse
Oh.
surgery. So that
Oh,
that
no.
goes backwards.
That's a bad thing.